Didn't buy ubiquinol, go and get ubiquinol, and if you can, get it in 150.
Yep.
Text from Dick. Dr. Ross, I've got a strange one. A multivitamin I was taking once a day gave me an overload of vitamin B6 of 700.
Yep.
It's now back to 97 after I stopped for a month. What's going on?
Well, he's not taking the big dose of B6 anymore.
Why do you think he got the...
Well, I think he got it. Dick's actually sent some stuff in before, and I think the reason Dick had this is because he is one of those people that has a enzyme abnormality in the MTHFR pathways. There are a lot of spin-off pathways from that, and B6 is very important in that metabolic pathway. So if you've got a particular enzyme defect, you're not metabolizing the B6 as much as you should. So he's just more sensitive to B6 than most other people. So he's just one of those people that should be avoiding B6 because he has naturally high normal levels of B6.
No brand names. Do you know of a multivitamin that wouldn't have B6? Is that a common sort of thing that they jam in multivitamins?
Most multivitamins have B6, but you look at the dose. If the dose is around 5 milligrams, it's hardly any B6 at all. That's not going to affect Dick whatsoever. But I think from remembering back to Dick's case,
I think I actually remember.
Dick was taking something like 100 milligrams a day of B6, which is a huge dose.
Good on you, Dick. Thank you very much for your text message. Susan's in Melbourne. Hey, Susan.
Good evening, Susan.
Yeah, thank you. A question on antibiotics. I'm immune compromised because I've got hypersensitive pneumonitis, and I take my Kepalate. Often they give me antibiotics before I even get an infection. Is that a bit confused?
Yeah, I don't really agree with that approach. I mean, the hypersensitive pneumonitis, I understand that it's an immune disorder. You do need immune therapy, and you're on the mycophenolate for that. But I don't think using prophylactic antibiotics in this day and age is a good idea unless there is evidence of a proven bacterial infection. I think this has been the problem. When antibiotics first came out, every man and his dog was given antibiotics for anything. I remember as a kid, I spent half my life in a doctor's surgery. If I had just a slightly runny nose, it was mainly from hay fever.
Stop, you tell you got a pill.
Yeah, I got an antibiotic. So I really don't think in your case, Susan, that you should be doing that unless there is evidence of a bacterial infection. Again, the mycophenolate will be controlling the hypersensitivity pneumonitis, so I think you can wait till there is evidence. Say you start coughing a very thick greeny sputum, by all means get it cultured and get onto antibiotics in that situation.
Thank you very much, Susan. Text from Jean on 0460 873 873. Jean says, Dr. Ross, my son-in-law had a pituitary gland tumour and he had it removed. Testosterone's very low, was using injections. Could he get an implant?
Yeah, absolutely. But you need to have that supervised by typically an endocrinologist who has a strong interest in reproductive endocrinology. But the implants occur every 6 months and they're very, very effective. I think they're better than getting the weekly injections.
Thank you very much, Jean. Healthyliving at 2gb.com. Coming up shortly, we're going to talk about liver fibrosis in mice. Before we do, what is liver fibrosis?
It's scarring in the liver.
Right.
Yeah.
Okay.
But I'll explain the relevance of liver fibrosis and why it is pertinent to we humans.
Yeah, okay. We were talking earlier about AI, influencing medicine.
Yeah.
And this gentleman hasn't left his name, but he says, to be honest, some GPs are substandard. And that's why people revert to Dr. Google. It can be more useful sometimes. My son went to a doctor recently and he asked my son, did he mind him using AI? What do you think?
Oh, look, I'm using AI now, but not so much to help me with diagnoses, but just to help me interpret the person's letter. And it's absolutely amazing. I'll have a conversation with someone and it takes out any of the social discussion and just puts in key points around the medical consultation. And so I think that as we get better, it'll be terrific to have AI enhancing the, as Nick said before, the quality of the diagnoses, and listen to the consultation and suggest some good diagnoses that maybe doctors haven't thought about.
And just on GPs, we do get some emails from people who are maybe having perhaps a relationship struggle with their GP.
Yeah.
And I've heard you speak about how, as the patient, you are the master of your medical destiny.
Yeah.
And just because a GP said something, doesn't mean that you have to, follow it or whatever.
No, but also I think it's great that people go to Google get some information and go and discuss it with their GP. And many people bring stuff, so, doctor, I found this article on Google, could you have a look at it? And I have a look at it and put it in perspective, because you see, the real estate people talk about location, location, location. Medical people, it's perspective, perspective, and perspective. And see, what Google doesn't give you is the perspective on your condition. All it does is just lists things and spits out diagnoses.
All right, very good. 131873 is our phone number. Plenty of room if you want to get in line and speak to Dr. Ross Walker, or send us a text on 0460 873 873.
3AW is hitting the road and broadcasting live from Motors and Masterpieces this coming Friday and